certain genes are dictators. I'm talking about the genes that say blue eyes or brown hair. They are dictators, they give orders, you can't argue. But the genes for diabetes are committees. They're making suggestions. And you could say, well, wait a minute. I don't really think I want to have diabetes. And in fact, most disease genes, whether it's for heart disease or diabetes or hypertension, certain forms of cancer, even Alzheimer's disease, they're not dictators, they're committees. And their activity depends on what we put into our bodies.
One study found that 2/3 of every patient admitted to the emergency room with heart attacks had pre-diabetes or undiagnosed diabetes, and almost none of them were diagnosed. Another important study found that the risk of heart attacks increases with any increase in your average blood sugar, even for those who don't have diabetes. That means even if you have a normal blood sugar, but it's sort of going up, you're at risk. And taking statins, the drugs for lowering cholesterol, and beta blockers for blood pressure actually cause insulin resistance and don't even correct this prediabetes problem.
The good news is that it is curable. Now, what is the cause of diabetes? Well, many people, when they hear that, they think, well, that's elevated blood sugar. And in fact, that's what many physicians believe, and they believe that most of the cause and the damage is related to the elevated blood sugar. But I'm telling you that it's simply not the case. The blood sugar is an artifact. It's a side effect of a more foundational physiological processes undergoing that most physicians are absolutely clueless of, because if they understood it, they wouldn't make the very serious mistake, and I'm calling it beyond serious mistake, of prescribing insulin for a type 2 diabetic, which I believe at some point in the future will be medically negligent practice and will be grounds for reprimanding a physician's license.
Taking insulin leads to a slippery slope of weight gain, higher cholesterol, and higher blood pressure. They only reduce your sugar in the short term, leading to a worsening of the syndrome over time.
Too many of them end up with a real low blood sugar, and as a result, they end up falling down, passing out from too low of a blood sugar. That can be a real danger.
Avandia, the #1 blockbuster diabetes drug in the world, contributed to the deaths of 47,000 people from heart disease in the first 11 years of its use. Now, this data was actually hidden from the government and from the public for most of that time by the drug company. A search for the diabetes gene and the magic bullet drug or gene therapy to treat it is going to lead us nowhere fast.
But people aren't hearing that. What they're hearing is you need to take one pill after another pill, and then you have to go on insulin shots. And these pills make you sick. As a matter of fact, they make you even fatter, and your diabetes gets worse, and you feel lost. And the problem is continuing. They expect within the next 30 years that 30% of the population in Western countries will suffer from type 2 diabetes.
Especially when we think about, too, the invasion of our children by type 2 diabetes. Used to be called adult onset diabetes. We might as well put the children thing in it, too.
1 out of every 3 little kids is going to develop diabetes in their lifetime. That is going to lead to heart problems, strokes, and even blindness. It ain't got to be that way.
There's lots of different drugs for diabetics that lower their blood sugars, but often at the expense of increased risk of heart failure, heart attacks, and bone fractures. There has to be a better way.
When a person has diabetes, their insulin key is not working. Why would that be? Why could insulin not signal this? What's supposed to happen is the glucose is supposed to enter into the cell. But the reason it doesn't happen, it's not that there's chewing gum inside the cell. What there is fat, little globules of fat. And that is what interferes with insulin's ability to work like a key to signal glucose coming in.
The sugar cells get coated in fat, the receptor sites get coated in fat, the insulin gets coated in fat. The end result is that we have a period of time where sugar can't get picked up by insulin. Medically, this is referred to as insulin resistance. But in fact, if we lower the fat, the dietary fat, for even a short period of time, insulin resistance disappears. It's not that the person is insulin resistant, it's that the conditions make it impossible for insulin to do its job.
There was a 90-day study done of 650+ participants at the Pritikin Longevity Center. More than 3/4 of them were able to get rid of their diabetes, basically. They no longer had diabetes when they ate this way. Kept that fat down, their diabetes went away.
Now you can up your defenses by eating more fruits and vegetables, having more vegetarian and vegan meals. These steps can be the power plays to protect you and your family against the risk of diabetes.
You put 20 diabetics, for example, on even a near-vegetarian diet, and in 16 days, half don't even need to take insulin anymore, and those who do are on half the dose.
Sure, vegans got lower diabetes rates, right? They're so skinny, right? But even at the same weight, vegans have just a fraction of the diabetes risk.
Processing meat will require a huge insulin response. The more protein you eat, the more insulin your body needs to make, thus increasing the chances of insulin resistance and type 2 diabetes.
High fiber, high carbohydrate, low protein, low fat diet. That's the diet that works the best.
In countries like China, Japan, Thailand, Cambodia, where it's a very high carbohydrate diet but a very low fat diet, they have the lowest diabetes rates in the world.
The American Diabetes Association position is that diabetics should be able to eat all the fruit they care for. This is not a problem. The American Medical Association has gone on record saying that blood sugar issues, although they are called blood sugar issues, they are caused from the overconsumption of fat, and that if we can just drop fat consumption down to acceptable levels, which science has shown us through the longest studies ever performed on humans in nutrition, the largest studies ever performed on nutrition, all the sports science shows us that our uptake, transport, and delivery of sugar into the bloodstream, through the bloodstream, and out of the bloodstream is dependent on our fat consumption, and that the more fat we consume, the less efficient our ability to uptake, transport, and deliver sugar, meaning that it gets stuck in the bloodstream.
Well, where does fat come from? It comes from two sources: animal products, animal fat, and vegetable oils.
We have a species-specific diet, whole, fresh, ripe, raw, organic plants, and we eat enough fruit so that we're satiated totally between meals, experience no cravings, and walk around guilt-free, happy, in a sweet life.
A whole food, plant-based diet with little or no of the three devils, oil and fat being one, sugar and salt.
If you follow this, I can guarantee you, you won't need those diabetic medications. We can cut your diabetic medications down right away. We'll have you become, we won't be controlling your diabetes. If you're a type 2, we'll be having you become undiabetic. And you'll get dramatic results that'll add many years to your life and prevent you from developing blindness, leg amputations, kidney failures, and all these horrendous tragedies that befall people with diabetes.
Type 2 diabetics are always curable by fixing the problem, which is the Western diet. Why not? Think about it. The definition, type 2 diabetes, a dietary disease by definition. Why couldn't you fix it? You can.
Make sure you're exercising. And exercise is really an absolute essential. Make sure that you get outside. Ideally, you want to get outside with as minimal amount of clothing as possible, that the sun is shining on as much skin as possible so that you can make vitamin D, because vitamin D absolutely is essential to controlling your blood sugar. You can absolutely cure this disease without drugs, without surgery, and mostly without supplements. So that's the key. You absolutely have the tools, the resources to take control of your health, and by applying these properly, you can do it. You absolutely can do it. It's just a matter of getting the discipline, getting the support, and knowing that you can absolutely take control of your health.